Hi, I'm Dr. Laurel Griffin at Precision Chiropractic West in West Des Moines, Iowa. Today I want to talk a little bit about post-concussion syndrome and symptoms relating to it. It turns out I see a lot of patients in my office with similar symptoms: headaches, neck pain, nausea, dizziness, lightheadedness, things like that. And I started to think about, and correlate with when I take case histories on patients. Have they had a head injury? Have they had neck injury? And I wanted to find out why these things correlate. Is there something, some shared injury between the two? And I thought about it specifically today because I did an intake on a patient who had had a concussion and jaw injury 40-some years ago. And she still has those symptoms that would qualify as post-concussive symptoms, but they're not specifically, because that was 40-50 years ago that injury actually took place. So and what I've done in the last year or so is begun studying imaging, MRI imaging, on the cranial cervical junction and the actual ligaments in that area. And what can happen, which I think is correlated with head injury, is that anytime you have a trauma to the head or neck, especially if it's going to be bad enough to cause a concussion, you're going to have definitely enough trauma to do it. You're actually going to have some injury to the ligaments that stabilize the cranial cervical junction. Why is that important? Because the cranial cervical junction, that's where your atlas bone sits. That's where your head sits on top of your atlas, which is the top bone of your neck. The rest of the neck is below that. There are multiple soft tissue areas there that are so extremely important, and that includes your vertebral artery, your brain stem, even your jugular vein as it exits the cranium can get close to the transverse process of atlas. And also the opening in the base of the skull, we can actually see on occasion when the bones have misaligned a little bit, that we are restricting the flow of CSF at the brainstem area, right at the opening of the base of the skull. But why I point this out with possible head injury, even if it's an old one, or neck injury, is that when those ligaments are injured, the atlas bone is able to move in directions and to a degree that it wasn't previously able to do, and that it's not supposed to do. And when it does that, you can actually put direct pressure on not just the nerves, put tension on the muscles and the joint capsules, but we've seen now on MRI that we can actually put direct pressure on the vertebral artery as it goes into the cranium, or in some cases direct pressure on the brainstem. Sometimes we're actually pulling the entire neck into a different position, and we see some cases where we've got cerebellar tonsils that are exiting the cranium a little bit more than they should, and that's affecting CSF, cerebral spinal fluid flow within the head. All of those things can be causing post-concussive type symptoms, or pain, headaches, dizziness, lightheadedness, things like that. A lot of those things, if we are able to get that atlas bone back in the right position, we're able to alleviate a lot of those symptoms. And with those ligament injuries, we are better able to assess that than anything else that I know of, in terms of correcting it, assessing it and correcting it. You need a very gentle approach when you're dealing with the cranial-cervical junction and ligament damage in that area, because of all those soft tissues that we're working with. But I just wanted to make that correlation and get that out there. We do a lot of work with all of those symptoms. If you've had any kind of head or neck injury any time in your life and you have symptoms like that, you need to have this checked out. We can usually get that stabilized, get you feeling better in most cases, and if we can't, we will let you know and point you in the right direction of who can help you. So give us a call. Our number is 515-224-1093, and let's get you on the right track, get you stabilized and get the blood flow to your head, get your head screwed on straight. I love that phrase, and we hope to see you soon. Bye.